Okay, I'm going to get started. I don't want to delay too much this morning. We are going to be talking about having COVID-19 vaccine in your offices to offer to your patients as they come through. So we're super excited to be at this point in the response. And I know that a lot of the FQHCs have been doing a tremendous amount of work. So thank you all for everything that you've done so far. Megan, if you want to go to the next slide, please. We're going to talk about some storage and handling guidance for the COVID-19 vaccine first. There are a couple important points that I just want to point out right off the top. So all of the COVID-19 vaccines, the storage and handling guidance, the guidance about who to give it to, it changes and has been updated several times since their EUA approvals. And the most relevant data is always found in the EUA fact sheet. CDC has a lot of great information. The manufacturer's websites have a lot of great information. And after a change is made, it usually takes up to a week to update the CDC and manufacturer's website, but the EUA fact sheet is always up to date immediately. So that's always the best place to go and look. As with any other vaccine, we don't want you to assume the viability of the vaccine. So if you've had a temperature excursion, or if you have a question about how long it's been out, or if it's been punctured for a certain amount of time, please put it back in proper storage and call the immunization program. You can go to the next slide, Megan. As I just mentioned, Moderna has some really great resources on their website, and Megan did a nice job of putting together information where you can find it. So the EUA fact sheet is linked at the top. The manufacturer's website is in the middle of the page, and then some information from the CDC is at the bottom of this page. You can go to the next slide. So Moderna, it's permanent storage. When it's sent to you, it comes frozen from the manufacturer. And because you're ordering from HRSA, your vaccine will be coming direct from the manufacturer unless one of your sites orders it and shares it with you. So in the freezer, and then it can be stored in the refrigerator for up to 30 days. All of these COVID vaccines are preservative free. So they have to be used within a certain number of hours after the vial is punctured. Moderna is 12 hours after the vial is punctured. You can go to the next slide, Megan.
Oh.
So Pfizer, again, EUA fact sheet, the manufacturer's website, and the CDC website are really great resources. And Pfizer has videos on their website, posters that you can put up in your clinic area. There's a lot of good resources on their site as well. You can go to the next slide. So Pfizer is the vaccine I'm sure you've all heard about that can be stored in permanent ultra cold as their permanent storage. There's no requirement that your offices have that ultra cold storage. It just means that you can extend the vaccine's life if you have that option. So it will come from the manufacturer in a package with dry ice, and then vials can be stored in a regular freezer with a limited freezer temperature. So you'll have to make sure that your freezer is tuned into that temperature range for up to 2 weeks, and then you can store the vials in the refrigerator for up to a month. After, when you want to use it, Pfizer is the only vaccine that I've ever seen that comes as a frozen liquid and also needs to be diluted. So it's not your normal vaccine that's reconstituted with a diluent. And once that vial is punctured, Pfizer has to be used within 6 hours. So there's information on the screen about how long you can keep it, how long it takes to thaw, all of that. You can go to the next slide. So for J&J or Janssen, again, lots of resources, and in the slides, you'll be able to click on all of these links. Janssen or J&J comes as a refrigerated vaccine. And then after you puncture, you have to use within 6 hours. This one's a little bit tricky. So if you keep it out at room temperature, it has to be used within 2 hours. If you put it back in the fridge after you puncture, you can keep it up. You can keep it for 6 hours. You can go to the next slide, Meg. All of the COVID vaccines come with ancillary supply kits from the manufacturer. So if you're receiving a shipment, it may come the day before, or it will likely come the same day as the vaccine is delivered. So ancillary supplies include the diluent for Pfizer, needles, syringes, alcohol prep pads, the COVID-19 vaccine card, and a really minimal supply of PPE. What your office will need to supply are the sharps containers, gloves, Band-Aids, or any other supplies that you use with the vaccine. We do not control the needles and syringes that come in these kits. And I know that we've had requests to change them. We do have a stock, excuse me, in our vaccine depot that we can supplement those supplies for you, but we can't swap things out because we're not the ones putting the ancillary kits together. You can go to the next slide, Megan.
So I'm going to talk a little bit about the temperature excursions and offsite clinics. So for your offices, I'm sure you are all very familiar with how to manage temperature excursions with your other state supplied vaccine. It's no different for the COVID vaccine. You would want to call our program to receive guidance if you ever have a notice that the vaccine experienced temperatures outside of the documented parameters. The thing that's trickier about the COVID vaccine is that it's just a little bit more complicated, those parameters. So there's different temperatures for the various stages of reconstitution and drying up. And we have a document that we've made with the temperature excursion protocol that is the same for all other vaccines, but it also includes all of the COVID-19 vaccine parameters. It's a nice document to have printed out and bring with you. Again, as Meredith has already said, we don't want you to ever assume the viability of the vaccine, and that also includes even with the expiration dates. So recently, J&J just extended their expiration dates from 3 months to 4.5 months. So these vaccines, because of how new they are, the manufacturers are continuously coming up with new stability information, both for temperature and for expiration for time. So always keep it at the appropriate temperatures until you can confirm whether or not the vaccine is actually expired or has actually been deemed non-viable by the manufacturer. And our program can help you through that process. So for offsite clinics, especially in the hotter months, we want to make sure that the vaccine is kept at appropriate temperatures. So this could be either after pre-drawing from a syringe or puncturing the vial, or if you're bringing it to an offsite location, or even just out of your parking lot. There is guidance with the CDC for how to package the vaccine appropriately. We also, as a program, have purchased many of these more official vaccine coolers. So if you are planning to do any kind of clinic for your patient population, which is not an expectation, this vaccine is really meant for normal practice operations. But if you are planning to have more of a clinic style administration day, these coolers are available from our program to borrow. There is a lag time in when you can request and then receive it. And then the panels do need to be conditioned, and it can take several days. So you want to make sure that if you're going to be doing that, you're planning for it. And then just a little bit about your inventory management. All the practices, all of the FQHCs are also enrolled in the Vermont vaccine program, and so are already managing state supplied vaccine. Some of your locations may have already also been managing the COVID-19 vaccine. As you transition from the state supplied vaccine into this federal pool of COVID vaccine, it's really important to make sure that those inventories stay separate in your various systems. So the VIM system is for the state supplied vaccine. You're not going to see your HRSA supplied COVID vaccine in that. When you're reconciling your state supplied vaccine, you don't want to be adding that into your inventory. The COVID vaccine from HRSA will stay in the VPOP system. And then something that might be different from if you have been dealing with the COVID vaccine from the state, the state has been managing all the second dose planning and shipments and orders. Through HRSA, it is the responsibility of the practices to be managing that. We did create this document to kind of separate the different processes for state COVID vaccine and HRSA COVID vaccine. And I believe later in this presentation, I received an email yesterday from Lauren Kempton from Notch, who was she volunteered to demonstrate the process of reconciling in VPOP. So that'll be great. And then Meredith is going to now talk about administration of the vaccines.
Thanks, Megan. You can go to the next slide. So, as you are all aware, these vaccines are currently being used under an emergency use authorization, which is different than the normal licensed vaccines. And the EUA fact sheets are really your go-to, as I said earlier, and there's two different EUA fact sheets. So there's an EUA fact sheet for the vaccination providers, which really replaces the package insert normally found with the vaccine. And there's a link for each of the 3 different manufacturers at the top of the page. It has a lot of great information in it for the people who are actually administering the vaccine. And then there's an EUA fact sheet for recipients, which replaces the vaccine information sheet that you use for licensed vaccines. And it is still required to make sure that the patient or guardian has had a chance to review that before vaccine administration. Several of those the EUA fact sheets are about 6 to 7 pages long. That's a lot of paper to print. So you are able to give these in an electronic format, either on your website. There's a QR code within the fact sheet. So if you laminate one and have it in your exam rooms, patients with a smartphone can scan that QR code and download it onto their phone. You can, if a patient is making an appointment, you can email it to them before their appointment. I'm just trying to think of ways that you can save paper. So there's a lot of different ways that you can have a patient access this. It doesn't have to be that you're handing them 6 or 7 pieces of paper. And then we have gotten quite a few questions about whether or not written informed consent is required for vaccines used under an EUA, and it is not. So you can go to the next slide, Megan. There are some clinical considerations with this vaccine. CDC has created a pre-vaccination checklist if that's something that your office would like to use. The link is at the top of the page. And then there is an observation period after this vaccine. So it's 15 minutes for the general population and then 30 minutes of observation for anybody who's ever had a history of anaphylaxis. It does not matter if it's from another vaccine or a medication or an environmental or food allergy. If they've had a history of anaphylaxis, they are supposed to stay and wait for 30 minutes after the vaccine. And then you are required to have some sort of Benadryl type medication and epi available within your clinic settings. I know a lot of offices have asked about space and timing for the observation period because it is quite long. There are some offices who have decided to give the vaccine at the beginning of the visit so that the time spent in the exam room counts towards their wait period. There are some places that have waiting rooms that are big enough that the patient can go back out to the waiting room and wait after their appointment. And as long as a receptionist or front desk person can be flagged if something is going wrong, that's acceptable. We've had lots and lots of creative ideas. So whatever works for your organization is fine. A staff member does not need to sit in an exam room for 30 minutes after a vaccine is administered to have eyes on the patient. So you can go to the next slide, Megan. There are some considerations for the use of the vaccine for those that are under 18. You have to have legal guardian consent in order to administer the COVID vaccine for anybody 17 and younger. And that can be a verbal consent. It can be in person. We've had some issues at clinics where we've had to call parents and get consent over the phone. And then just want to reiterate that in the state of Vermont, anyone under 18 has to have consent for any vaccine. So this is not any different than any of the other vaccines that we give. Your practice can establish your own process through consent. So really, whatever works for you normally, you can add COVID into that. It is important to note that the reactions for the adolescents are very similar to the reactions for adults. So we are seeing that people kind of feel crummy after their second dose. This is true for the younger teens as well. And then CDC just wants us to remind you that fainting is definitely more prevalent in adolescents. If you can go to the next slide, Megan. These are resources that I use almost every day. The top link, the interim clinical considerations, is a document that I'm in and out of several times a day. And it really has good information about the vaccines themselves, co-administration with other vaccines, allergic reactions, administration errors. It answers quite a few of the questions that come through to our email box in our program. And then there's a whole site that CDC has developed about how to manage and be prepared for allergic reactions with these vaccines. So that is the second link on the page. The third link is a clinical consultation that CDC is offering for questions about the COVID vaccine. And I've submitted questions and I've sent this link on to providers. And I've gotten great responses, and the providers that I have sent the link to have also said that they have received responses usually within 24 hours. So if you have questions that aren't answered in that clinical consideration document, or you can't find information, that's a great resource for your clinic to have. And then I just linked the Immunization Action Coalition, the Ask the Expert sites down at the bottom. They have a huge page with all sorts of COVID vaccine related questions, and it's a really great resource as well. You can go to the next. So this is a slide from the Pfizer manufacturer's website, and they actually have a poster about how to mix the vaccine, how to administer the vaccine. And if you're going to use Pfizer, this is something that I would probably print and put right in your clinic prep area or your vaccine prep area. As I said before, Pfizer is the only COVID vaccine that needs a diluent. So you're going to receive the preservative-free normal saline with your shipment. You have to mix 1.8 milliliters of that diluent into your Pfizer COVID vial. They want you to gently mix it. And then this is a 0.3 ml dose. The other two are 0.5. So this one's really different than the other two. There's a lot of good do's and don'ts on this page. I'm not going to list all of them. You can go to the next slide, Megan. So there's great resources about preparation and administration on the left-hand side of this screen. And because you're puncturing the vial so much, they do want you to alternate your insertion points into that vial stopper so that you don't have leakage. And there's some other great tips on here too. They do try and give you the low dead volume syringes when they send out the Pfizer ancillary kits. Sometimes you cannot get all 6 doses from the vial if you don't have those low dead volume syringes. So I would not be surprised if you get 5 doses sometimes. You can go to the next slide, Megan. So this is a slide from Moderna's website. And the thing that I really want to point out here is that Moderna comes and it's a white to off-white liquid, and it is a 0.5 ml IM injection. And there are resources on the left-hand side again. You can go to the next slide. So the Janssen or J&J vaccine, same thing, resources on the left-hand side of the page. This one comes and it's either colorless or slightly yellow, so they're all a little bit different. And this one is also a 0.5 ml IM injection. You can go to the next slide. You can bill for the COVID-19 vaccine administration. And if the patient is there for an office visit, obviously you can code for your office visit. And there is a special administration fee that you are allowed to also bill for. These vaccines are supposed to be or need to be free for your patient. So if for some reason the patient does not have insurance or the insurance doesn't cover the administration fee, you cannot pass those fees on to the patient themselves. There is a provider relief fund linked down at the bottom of this page that you can seek reimbursement if you have patients that can't pay the administration fee or their insurance doesn't cover it. You can go to the next slide, Megan.
So I'm going to talk a little bit about the reporting. So reporting to the immunization registry for COVID vaccine is very important. Many of you will be reporting automatically through your established HL7 system, where when you enter the shot into your EHR, it will automatically be transferred to our state registry. It is encouraged for you to be immunizing outside of your patient population. Again, you don't have to, but if you're immunizing one person and a non-patient comes in with them, a family member, and you want to immunize them as well, we would definitely encourage you to do so. If you are doing this and you are planning to not enter them into the EHR system through that automatic HL7 system, we would want to make sure that you have a workflow in place where you are going to be entering that record manually into the registry. We know that many of you are entering the patient records into your EHR so that you're able to see them in your own systems as opposed to just looking in the registry. When you do this, it is really important that the records be entered accurately. So you don't want to really be trusting a patient's testimony about the date or estimating a date or using the date of the patient's office visit. You want to be trusting either the date that's presented in the registry already or on the vaccine card that the patient receives after their doses. All that information needs to be put in accurately or else the records get duplicated in the registry, and it really throws off some of the state reporting. As I'm sure you're all aware, the COVID reporting in the registry is really important for many reasons. It goes to the CDC, it helps dictate our state policies. So making sure all that information is correct is vital. We do know that as you're starting out in offering the vaccine to your regular patient population, you may be looking to assess the patient need that you see, and that need may be relatively low. We know that this can be difficult because that information is not already in your medical records. There are these reports that you can run from the registry, and the registry is willing to help with that process. In addition, I know that the by-state contact, Heather Skeel, is helping some of the locations with this process of assessing the patient need. But the links for the reporting, instructions for running the reports are on this screen and will be sent to you.
So I'm going to talk about the importance of VAERS, and I know you're all familiar with VAERS, but since these vaccines are new and being used under an emergency use authorization, CDC has really requested that people report to VAERS. It's the way that the anomalies with the J&J vaccine were caught and why the vaccine was paused in order to allow them to gather additional information. And we really, really, really want to make sure that the vaccine continues to be safe, which it has proven to be. I did not realize that you could, as a patient, you can report to VAERS, and then providers, of course, are required to report to VAERS for certain types of events. So you can go to the next slide, Megan. With COVID vaccine, CDC developed a new smartphone-based technology that allows the patient themselves to get a daily health check-in via a text form, and it really just checks in off the like, what are your symptoms? Did it affect your ability to do daily activities? Did you have to seek medical care for your symptoms after vaccination? And if they're severe enough, somebody from VAERS will actually follow up with the patient and get more information. With the addition of the approval for ages 12 and older, they did make a change to VSafe to allow parents and guardians to complete the health check-ins on behalf of their children. So I don't know if any of you used it when you got your vaccines. It was really simple. It took less than 2 minutes to fill it out, and it comes to you on a regular basis after your first and second doses. You can go to the next slide. There are some lots and lots of great resources. So we just put some links for some of them on this page. The top page, the CDC page, there is a way to get an email when they've updated a resource on this page. So if you look over on the right-hand side where it says get email updates, if you find that on the CDC link and type in your work email address, it will send you an email every time they update one of their resources. And then VDH has a lot of resources on our page as well. There's a whole healthcare professionals COVID vaccine website. And then once your office starts administering COVID vaccine, we have a weekly office hours on Thursday afternoons from 1 to 1:45, and your office will be invited to attend those. There's a really good mix of people that have been doing mass vax clinics and primary care providers who have started to onboard and offer vaccine in their office. So it's a good way to get some basic updates. Just as a note, I know that it's FQHCs only on the phone or on the call today, so we don't discuss HRSA specific program updates. You get those in a different way. You can go to the next slide. So this is just a way to contact our program. The top one is our program email box. The middle one really is for state supplied ordering and distribution of the vaccine. And then the bottom link is specific questions for the immunization registry. And at the end of this slideshow, there are more resources. There's a training that CDC has put together, and all the links are in that slide.
So I see that Heather Skeels has come on. I wanted to, hey Heather, I wanted to see if, do you have anything you'd like to say to this group?
Only that I'm with Bi-State Primary Care Association, for those of you who don't know me. And I am available to you whenever you have a question about the HRSA allocation. I'm happy to get you an answer. And I'll put my email in the chat.
Great. And we did get an email from Lauren Kempton about presenting some VPOP information at the end of this slideshow. I don't see Lauren on. So maybe we can just go to questions. You can put questions in the chat or you can raise your hand.
I have a question for the Notch organizations that I see that Matt and Brad are on. Are your offices going to be ordering individually for each office, or are you going to continue to order at Richford and then distribute the vaccine?
This is Matt. Yeah, we're going to order centrally in Richford and distribute.
Okay.
I mean, until we see what sort of volumes we're talking about, I'm just not expecting enough volume to warrant individual offices ordering.
Yep, that makes complete sense. I just, for my own information, I just wanted to check in. That's great.
So, do you mind if I say a few things about VPOP?
Sure.
Yeah, absolutely.
Please do. We don't have access to it, so that would be great.
Okay. I wish, yeah, I thought Lauren was going to be on and do like a screen share if she could, but I'm not prepared to do that. But so VPOP is the application that each site is going to use to keep track of inventory for this vaccine. And so it's going to be a manual process. I've been using, Lauren and I have been using VPOP for, I don't know, since the beginning of the HRSA program. But it's been relatively simple because we have one application, one site, and it's one bunch of vaccine. Now we're kind of splitting it up, and what I hear is that the process is pretty manual. So if we send out 10 doses, or a vial to every clinic, let's say I need to reduce the Richford site and you all need to add that. And so what we'll do is Lauren will support you in that. So like when we do get VPOP up and running for you, she'll either come around or help you virtually through that process. It's really pretty simple. It's just new. And what I just want to say is just be careful. Don't because I think if you do get access, you'll probably be able to theoretically submit an order, and just don't do that, because then you'll have a whole lot of vaccine on your hands. Has anyone received an email from VPOP or CDC? I'm not sure exactly what it's going to come through like. Okay, so I did set the clinics all up, and I think that was that's the first step. And so I guess let me know if you do receive an email asking you to set up a password or an account or something like that, because I don't really have a way of knowing that process is working.
I guess I would just share, Matt, that it does look a little bonkers, and please check your junk mail because it comes from one of those weird anonymous looking sites. So if Andy has tightened down your email, like I suspect he has, it may go straight to your trash. So you may want to your junk. So take a look.
That's a great point. Thank you.
We may have had that happen already.
Heather, do you want to say anything about the sharing of vaccine and some of those changes?
Sure. So there are a couple of ways. If you do, I don't know, accidentally order more vaccine than you can utilize, there are some ways for you now, paths forward for you to share with another community provider. And I did send that information to Matt, so he's aware of that process. And then you can also share with another FQHC if that's what you want to do. So, you know, when the trays were huge for Pfizer, that was a good way for a couple of health centers to be able to share a tray. You could even split a 450 tray if that's just too much vaccine for you to get through. Things are really, really slowing down. So I completely understand that. So those are the two modalities. Matt has information on both. I don't know what other health centers are on, but I have sent that out widely, but you can always email me if you need to see it again.
I'll include those documents that you sent, and it went out with this meeting invite. I'll include them again when I send out the recording and the slides.
Thank you so much, Megan. That's really helpful.
Are there any specific questions about using this within your clinic flow? Have you guys talked about how you might be able to do that? I know it's a huge shift from the community clinics that everybody's been doing.
One thing we didn't talk about, Meredith, was about waste, and that came up in our last HRSA meeting. Do you want to talk a little bit about the change in priorities?
Yes, thank you so much. So in the beginning of our vaccination effort, I'm sure you all heard on the news that there was a huge amount of pressure to waste no doses and find arms to put the vaccine in, have wait lists. And I'm sure Matt and Brad can talk about what a tedious process that was. As we have slowed down, and you know, almost 80% of Vermont's population at this point has been vaccinated, and we're moving the vaccine into primary care and away from the mass vac settings, we understand that that's not feasible anymore. And the message coming from CDC and coming from HRSA at this point is that they want you to focus on the opportunity to vaccinate somebody when they're in your office, and not to worry about missing that opportunity because of potential waste. So the example that was given on a CDC call was, what if somebody shows up 5 minutes before my clinic closes and says that they want a COVID vaccine? And the response from CDC back was, please open that vial, please give the vaccine, don't worry about the other doses in the vial. So they really, really, really want you to not miss an opportunity at this point. And it's, I know it's a big shift. It's a big shift for me too. So
I would say the other information that I got this week was actually from the NTAP, so that's another group that supports federally qualified health centers, from the homeless NTAP, and they said it's an investment in the rest of your community if you don't use the rest of that vial. So getting that person vaccinated is really the most important thing, and not to worry about any of that wasted doses. And it is an investment in your community because that's one more person who will not be spreading COVID. So that's good news.
Yep. Thank you, Heather.
Mm-hmm. Well, I just am repeating it. Somebody else did that thoughtful thinking. Meredith and Megan, did you all talk about the J&J extension?
Megan did. Yep.
Okay, good.
Yeah, and putting it in the context of, you know, more and more of these stability updates are going to be coming out because of how new these vaccines are, and to never really make an assumption, keep it at appropriate temperatures until you can confirm 100% with our program or the manufacturer that the vaccine is actually not viable before removing it from your refrigerator or freezer. Yep.
I thought that was really exciting news. I was super happy about it.
It is.
Yeah, it's nice not to throw away a bunch of vaccine.
Right, because we have a deadline coming up, right? The 23rd, I think, for a bunch of the state vaccine.
We do. Yep. Yeah. And knowing that our supply of J&J has been very limited, I know that HRSA has been able to allow people to continue to order, but states have not been given a chance to order J&J. I think this is the 3rd or 4th week in a row now where we have not been able to order any additional J&J vaccine.
And I'll be sending an email out from our program, so from the immunization program, that will have the link to the manufacturer website, which gives some pretty comprehensive instructions for assessing the expiration dates on your vaccines. So if you do end up getting J&J, eventually that website will continue to be a good resource for you.
Did you all make a pitch for your 1 o'clock call?
We did.
Okay, good. I'm sorry I missed the beginning of the meeting. Those 1 o'clock calls are incredibly valuable. I always find out something very helpful at those calls. And I do go, so if you have to miss a call, feel free to email me and I'll tell you what happened. Except for next week, I'm on vacation. So you have to email Meredith.
We do send out the slides and the notes afterwards too, so.
And just with those office hour calls, like we're really excited to have all of these new offices come on and to be able to use each other as a resource during that time. You know, we started out with just the very limited locations that were receiving and administering vaccine, and now that it's expanding, we think that the content and the focus is going to change to be more focused on what you're actually seeing in your offices, as opposed to the broader state conversation, which is what it's been mostly. So definitely feel free to come with questions and we'll do our best to answer them.
I don't want to keep people. I know that you all have busy clinic schedules. So Megan, we are going to send out the recording and the slide deck for this training, correct?
Yep, and it'll come with all of the resources that Heather's been providing as well.
Perfect. Thank you, everybody, for taking time out this morning to come. So excited you're going to have COVID vaccine. No.
Even more COVID vaccine.
I know. All right. Have a good week or have a good day and have a good weekend, everybody.
Thank you.